main thing that attracted me to OrthoPartners were the people in the group. I think the people here are some of the nicest and kindest people I've met. They were very welcoming. I think the area they serve is also very nice and friendly, and it brought me close to my family, which is what mattered to my wife and I the most. My name is Karan Patel, and I'm a spine surgeon with the Orthopedic Partners. Right after college, I started medical school at NYU. I then did a 6-year orthopedic surgery residency at NYU, and then I went from New York to Chicago, and I did a 1-year spine surgery fellowship at Rush University. There's many different parts of spine surgery, and the one I like the most and would eventually specialize the most in is minimally invasive spine surgery. In a minimally invasive spine surgery, we avoid a lot of the muscular dissection as we can. We try to go in between muscular planes to limit the morbidity that we cause to surrounding tissues and still accomplish our goal. Often, a lot of spine conditions present as hip pain or butt pain. It can get confused with pathology in the hip. It really is a teasing out from the patient's history and their examination what is the source of their pain and what is really causing it. Typically, pain that radiates down the arms or the legs is likely to come from a nerve in the spine, but often if it's just localized to the low back and the buttock, it could be a combination of the hip and the spine. It's just something that we'd have to tease out together. Traditionally, we just use X-rays and look at the spine and use anatomical landmarks, and now we're able to do that with the use of CT-guided navigation or computer-guided navigation to help place screws in an appropriate position, but without really having to dissect the full spine and the musculature around it. We're now able to approach the spine from the side and do a lateral inner body, or from the front or an anterior inner body through small incisions with retractors that have been developed to help keep us safe, but keep us centered on the spine so we don't have to, again, cause too much morbidity while we're trying to address a patient's condition. Even though I'm a spine surgeon and I love to operate, I think the majority of the treatment that I provide my patients will be non-operative. Not everybody needs surgery, not everybody needs surgery right away. Often it would involve a lot of the non-operative techniques such as anti-inflammatory medication use, physical therapy, really working on strengthening core muscles or the neck and upper back, and even injections, if necessary, steroid injections near the spine. So it is a long road to manage a condition, and most of it is non-operative, and often a lot of people feel better with just that and don't really need to go down the surgery path. One of the great things about Orthopedic Partners is that we have everything under one roof. Not only do you have a spine surgeon, but you also have a hip and knee specialist, shoulder specialist, and physical therapist here as well. So if based on my examination and x-rays and imaging, I feel like maybe the patient's pathology is more coming from the hip, I can always send them to some of our sports medicine or hip specialists to take over care or further manage a patient. Often, a lot of patients will just improve with physical therapy and injections, and I can send them to the therapist here or the pain management specialist here to deal with management of chronic pain or injections, whatever a patient needs really to resolve their issues or begin to feel significantly better. Some of the simplest things that can keep your spine healthy is just being active, exercising a couple days a week, keeping your core strong is very helpful. One thing we've been seeing a lot are cervical problems, especially in the younger generation. People in their late 20s, 30s come in with a lot of neck pain. And I think the way we use our cell phones and laptops and technology is to blame. So just be cognizant of your posture. Keep your phones elevated, and so you're not looking down a lot. So a lot of it's a lifestyle change that can prevent many spine conditions. Just be active and healthy.